Hello, my name is Dr. Elisa Geskin. I'm the Director of Cutaneous Oncology and Photophoresis Unit at the University of Pittsburgh School of Medicine. This presentation will discuss the procedure involved in performing Therakos photophoresis. Therakos photophoresis is indicated for the palliative treatment of skin manifestations of cutaneous T-cell lymphoma or CTCL that are unresponsive to other forms of treatment. CTCL is a non-Hodgkin's lymphoma characterized by the malignant proliferation of CD4-positive T lymphocytes that infiltrate the skin. Treatment with Therakos photophoresis is thought to act in several ways in order to restore the body's natural ability to maintain a balanced immune system. More information can be found on this website. During Therakos photophoresis, peripheral intravenous access is usually obtained, although alternative devices, including indwelling and temporary catheters, subcutaneous ports, central venous catheters, implanted devices, AV fistulas, or shunts may be used in certain situations if they meet specified requirements. Whole blood is collected in the photophoresis instrument, and the blood is centrifuged to separate the leukocyte-enriched blood fraction, also called the buffet pool, from the red blood cells and plasma. The leukocyte-enriched blood fraction remains in the instrument while the other blood components are immediately returned to the patient. Step 2. In the treatment bag, the leukocyte-enriched blood fraction is directly injected with 20 micrograms per milliliter of Uvadex. The medicated blood fraction is then exposed to automatically calculated amount of approximately 1.5 joules per centimeter squared of UVA light. Activated Uvadex covalently binds and cross-links DNA, leading to apoptosis of treated cells. The treated cells are then reinfused into the patient. Treatment with Therakos photophoresis may take several months to see a response. Normally, patients should receive treatment on 2 successive days each month for 6 months. An adequate response is at least a 25% improvement in the skin score within the first 8 treatments. That is maintained for at least 4 weeks. For patients who fail to show an adequate response after 8 treatments, an accelerated treatment frequency may be used, with treatment schedules increased to 2 successive days every 2 weeks for 3 months. In clinical trials, patients who achieved a positive response were maintained at the schedule of 2 successive days of treatment every 5 weeks for at least 3 months. If initial response continued to be maintained, frequency may be decreased gradually or discontinued entirely in some cases. If a patient has achieved no response or less than adequate response after 20 treatments, clinical judgment should be used to decide if photophoresis should be discontinued. Therakos photophoresis has an established safety profile. More than 500,000 treatments have been given to patients since 1987. Serious side effects are rare and are primarily related to hypotension secondary to changes in extracorporeal volume of greater than 1%. They include fever and worsening of skin redness and resolve within 1 day. Photophoresis does not cause immunosuppression and is not associated with an increased risk of opportunistic infections, secondary malignancies, lipid or endocrine abnormalities. Extracorporeal photophoresis therapy can make patients more sensitive to sunlight for about 24 hours after the treatment. Patients should take the right precautions to reduce the risk of cataracts or serious sunburns. It is suggested to protect the eyes and skin by taking the following simple but very important precautions for 24 hours after each treatment. Avoid sunlight as much as possible, even indirect sunlight coming through a window. Wear sunscreen SPF 15 or higher when exposed to the sunlight. Wear UVA protective full coverage sunglasses when exposed to sunlight. Other possible side effects are usually minor and go away within a day. This could include fatigue, temporary increase in itchiness, or slight fever or redness appearing 6 to 8 hours after treatment. As with any procedure that involves a needle function, there is a small risk of getting an infection. Please see the complete prescribing information and important safety information on this website.